Hi, welcome to Pennsylvania Newsmakers, and as always, thanks for watching. Well, the National Health Care Bill is now law. What's in it? Stuart Shapiro is here, and he will analyze. Then it's Financial Education Month. Why should that matter? Pennsylvania politics and government, in depth and in detail, and guess what? It all starts right now.
This is Pennsylvania Newsmakers, a fast-paced, unrehearsed weekly discussion with and about the leaders who shape your world. And now, here's your host, Terry Madonna.
Hi, welcome back to the program. Well, as you know, the National Health Care Reform Bill is now law. For the next couple of months, everybody will be trying to figure out what's in it and why does that matter. As often is the case, we have our own healthcare experts. Dr. Stuart Shapiro is one of them. He's the president and CEO of the Pennsylvania Healthcare Association. He comes in, helps us analyze these complicated healthcare matters. And boy, it is kind of complicated, that bill, isn't it?
It is kind of complicated, and we've discussed this many times on this show. And the question is, and it was a very tough vote for many of the Pennsylvania legislators who had to vote on this.
Right.
Because they were asking, while it was certainly morally right for a country like ours to have health insurance for everyone. In fact, we're the only industrialized country that has not had it in the entire world. The question really is, was it worth the risk? And the risk is also a moral imperative because it's going to increase the debt over the next several years. And the question is, will it begin to bend the cost curve? Now, what's in it? There's some things that happen absolutely immediately or within the first year. People are going to not be able to be denied coverage based on whether they're sick. Right. They're not going to be able to be removed from their insurance because they are sick. Their children, who are up to age 26, will be able within the next year to enroll in the parents' policy.
Right.
Those are all very, very important provisions. There's also some very good provisions that will kick in again within the first year that will begin to give rebates on prescription drugs to the seniors. There's also, pretty soon, there's going to be some expanding coverage in neighborhood health centers. So there's some very positive features.
Right.
The real mandated health insurance doesn't kick in until 2014, 3 years away. And then we have to start to pay for it.
Yeah.
And that becomes the problem.
Yeah. There's sort of two or three things that are controversial. One is, to what extent will the government regulate literally health care down to the patient level as it oversees the insurance industry? And the other one is the cost. Let's go to the cost for a moment. The numbers that I've seen, and the cost of health care has never been estimated accurately, whether it's Medicare when it was first created or other expansions. So
it's always been underestimated.
Yeah, that's what I mean. I'm sorry, underestimated. The cost of this is obviously going to be a huge thing. Go ahead, talk a little bit about that.
It's going to be close to $1 trillion over the next decade, so they're predicting now.
Right.
That presumes that part of it's going to be paid for with $500 billion of Medicare cuts. Whether that will ever happen, I don't know.
Well, hold on a minute. Now, with senior citizens, 75 million people beginning in 2007 going to, the next 25 years, Doctor, going to be 75. Politically, can you cut I mean, you've been following this for a long time.
Absolutely.
Can you cut Medicare?
I don't think you can safely cut Medicare to the dollar values that are in that legislation. They're also paying for this by it's in the bill. It happens in 2018 is when they begin to tax high cost plans.
Yeah.
And whether that's going to ever happen, the tendency is always to put this off. So while we have the great moral imperative, the good, the positive, of covering 32 million people, and many of them need this coverage desperately.
And let me just stop you right here. I mean, in all the polls that have been done, the citizens of the country rightfully support the notion of covering Americans. It's how we do it that's in this debate. Am I right or wrong
Absolutely.
about that?
And whether we can do it right now.
Yeah.
And then the things that aren't in this bill
yeah.
that hopefully will get fixed over the next year or two or three, and that's some tort reform.
Yeah.
So they'll give the providers of care some protections when they do what's right from having to just do repeated tests to try to protect themselves.
Yeah, I mean, look, you're, in addition to what you do, you're a real expert on Medicare and Medicaid programs. You know how they function. You represent, you know, folks who obviously require the payment for those, or your facilities couldn't even am I right? You couldn't even operate without these.
Well,
I mean, these people go ahead.
Let me tell you what's happened in Massachusetts, because I think it reflects on that. They passed health care reform 3 years ago. The costs have gone up 50%. They predicted that emergency room visits would go down by 75%, but in fact, emergency room costs have gone up 17%. And hospitals, which have a lot more people covered, so they don't have the uninsured, are under-reimbursed and are on the verge, many of them, of bankruptcy, so they're now suing the state of Massachusetts. We depend, all providers, in order to provide the kind of care that people want, Medicare and Medicaid. Medicaid doesn't cover the full cost. Medicare pays very adequately, and it compensates for those that are on Medicaid. So if you try to take dollars out of Medicare, you're going to run into real problems.
And the other thing is here's what I understand, and we're going to go to break. But the private insurance market, because Medicaid operates at a loss, so the private insurance market funds the underpayment for Medicaid for lots of facilities. Am I right or wrong?
It does for hospitals. It doesn't for hospitals, but not for nursing homes. It does for doctors, but not for nursing homes. And that's why the nursing homes have such a challenge in caring for the elderly in Pennsylvania.
And boy, if
today.
anything, we're going to run to a break, but there's going to be a huge amount of pressure on your facilities with people getting older. They can't, everybody sort of wants to take care of folks in their home, in their house, but at some point you can't do that. I mean, for some people, not all people, right or wrong.
Those are the challenges we'll talk about after the break.
All right, we're going to break. We'll be back in a moment.
This broadcast of Pennsylvania Newsmakers is presented by the Pennsylvania Chamber of Business and Industry, the statewide voice of business, and by the Pennsylvania Cyber Charter School, bringing educational innovation and freedom to the children of Pennsylvania. This broadcast of Pennsylvania Newsmakers is presented by PAConstructionJobs.com. For more information about rewarding careers in the highway construction industry, visit PAConstructionJobs.com. And by the Pennsylvania Manufacturers Association. Business in Pennsylvania is our business.
Hi, welcome back. We're talking about the implications for the National Health Care Bill, how it affects you. The host asked a complicated question to the guest just as we were going to break. All right, doctor, look, this has to put huge pressure on nursing homes, less money, Medicare, if the $500 million billion is not put back in. This is a huge consideration. Talk about that.
It's a huge consideration for the elderly, who, when they get sick as they get older and need chronic care, often people haven't planned for what they're going to do, because Social Security won't pay for it.
Right.
Medicare only pays for acute
90
rehab,
days,
90 days.
90 days, yeah.
And most people don't have long-term care insurance, so they ought to begin to think about that when they're in their 30s or 40s or 50s, not when they're 70 or 80. The health care reform bill included a little tiny piece of long-term care, but not much, and it's a voluntary program. So what this does in Pennsylvania and in other states is it forces the Medicaid program to cover the care of the poor elderly. And that number is those numbers are going up rapidly in Pennsylvania, and they're going up even more rapidly now given the recession we have. And they're going up not only because people are poor, but those who had enough money are spending down much quicker, and therefore it's really squeezing the nursing home.
Now, there's another aspect of this, and that is that it's Medicaid is a joint program funded by the feds and the state government, and with states hard-pressed for budgets, that means that state budgets will be affected by Medicaid as well, yes or no?
Yes, and fortunately, and I think it's going to happen, the federal government, the Congress will extend what's called the enhanced federal match through the end of 2011, or fiscal year 2011, which ends next June 30, a year from now.
Right.
The problem is going to be what's going to happen in the future. And when you look at the Pennsylvania budget today, it's $28, $29 billion. And about 10% of that is federal stimulus dollars. And when you add then the growing elderly that's happening in this state and the removal of the enhanced FMAP, we're going to have a real budget crisis. And if you try to then compound it by decreasing Medicare funds, what's going to happen to these elderly who need the services is going to be a real problem.
So in other words, you're in this sort of catch-22 situation. But in addition to that, on the state budget, when the Governor Rendell recommended his budget this year, which passed the House, I think, on March 22nd, it's now over in the Senate. This is a new $20 billion increase over last year. He's counting on $850 million on the Medicaid side to balance it.
And he's going to get that money from the federal government.
And you're confident?
I'm not. I'm more than just hopeful. I think he was quite right to predict those dollars would come forward. If we didn't, we would have a real crisis. The problem is going to be that that's just holding the safety net together for the elderly. When that money's removed, we're going to have some real problems. And while people want us, when they're getting sicker and older, they want to stay in their homes as long as they can, and that's fabulous, and that's what I'd want, and that's certainly what you'd want. But the question is, when they need nursing home care, it ought to be provided in a way that the state pays adequately for the services that are provided. So we don't have what happened in Massachusetts with the hospitals when they were inadequately paid, even though more people were covered.
In a minute or so that we have, are you concerned that that one of the criticisms of the health care bill was that people said, well, you're going to have big government looking over looking behind the insurance companies saying, pay for this, don't pay for that. You can only get this kind of treatment. You can't get that kind of treatment. Now, as a doctor, does that raise some concern with you, or in your facilities, that big government will be telling your folks what they can do and what they can't do?
I don't think there's any real evidence that that's in the bill.
Okay.
I think that was a lot of scare tactics.
Okay.
But I do think that there has to be some rational decision-making, that a doctor can't just order, or a hospital or a nursing home, whatever, anything that they want.
8,000 tests, I'm exaggerating.
But that's why you need some real tort reform. But I don't think that there's the
So doctors don't play defensive medicine, that's your point.
But the death panels and all that stuff, that was all rhetorical nonsense, quite frankly, because that is not in the bill.
Okay. Well, look, I want to thank you. Great update. All right, when we come back, it's Financial Education Month. We do this once a year. Governor Rendell has even weighed in on this and has talked about the programs that are underway for financial literacy in the schools. Our friends from the Pennsylvania Credit Union Association are on as usual, and we'll be back following these words.
This broadcast of Pennsylvania Newsmakers is brought to you by Pennsylvania Credit Union Association. Pennsylvania Credit Unions, where people are worth more than money. To find a credit union that is right for you, check out ibelong.org. And by the Energy Association of Pennsylvania, Pennsylvania's energy information source. This broadcast of Pennsylvania Newsmakers is presented by the State System of Higher Education. 14 state-owned universities. The state system is the largest provider of higher education in Pennsylvania. And by the Hospital and Health System Association of Pennsylvania, working towards a healthy Pennsylvania.
Hi, welcome back to the program. Well, we're continuing this series on financial literacy. We argue how important this is, that getting this training and understanding your finances is not just something you should do when you're, 65? How about 15? Joining me, as often is the case, is Mike Wishnow. He's a senior VP with the PA Credit Union Association, and Mary Rosenkrans. She's director of the Pennsylvania Office of Financial Education. All right, Michael, we've been on this for a long time, and it's not 65 or 55. Give me a good age.
How about 5?
55, okay.
How about 5? Seriously, I mean, financial education is something that needs to be taught from the earliest of ages. I mean, literally at age 5, the Berenstein Bears, The Trouble with Money, you can read that to a 5-year-old. They can understand the difference
I don't know
between
about this. Go
wants
ahead.
and needs, and that's where financial education starts. It's really a lifetime experience, right, Mary?
I mean, at every point in our life, we need to have financial education. Whether we're in school and we're learning about needs and wants, or starting a budget, or going off to college, planning for retirement, there's always points in our life when we need to have information to help us make smart money decisions.
Yeah. I mean, there's some of this data that you have here that's I mean, 53% of parents think that their children thinks money grows on trees. I mean, and you know, go ahead. You have a couple more of these. I mean,
you know,
read these off.
Sure, 30% of parents say that their child's high school offers any kind of course. 76% of parents say that their high school kid does not budget his or her money.
Oh,
and as a group, you know, teenagers are spending $169 billion.
$91 a week here on average, and they know very little about what we could call personal financial responsibility, right?
Correct.
All right, well, let's talk a little bit about Financial Education Month. Governor Rendell recently, I got a press release, you know, had released a statement talking about what's been going on in this state. Give us a quick update on that.
Well, every April since 2004, Governor Rendell has issued a proclamation making April Financial Education Month. And nationally, we've been celebrating this since the year 2000. It's to put focus on the importance of financial literacy, and to also then help people to find out where they can get resources to help them make smart money decisions. One of the places that we know where financial education can be incorporated is in our schools.
Right.
And you're absolutely right, Mike.
Yeah.
It can start as early as kindergarten, because we know that even at a very early age, children decide whether they're savers or spenders. Yeah. And we think that students should graduate from high school with the basic skills in terms of saving and knowing about credit cards and how to establish a budget.
Yeah, maybe it starts with that little piggy bank. Instead of running down to the store and getting some candy, you put that money in a piggy bank.
Oh, absolutely.
Now, look, one of the things that we talked about over the years, and why not a little quick update about the foundation that you run in which you're taking financial education into the schools. Talk about that.
Sure.
You have 156 school districts.
Correct. Pennsylvania has 501 school districts. The Pennsylvania Credit Union Foundation, in conjunction with various credit unions across the state, are in 150 plus schools. In some schools, we're simply teaching in the classroom.
Right.
We have 31 schools where there are in-school branches. These are branches of a credit union that complement the academic learning so that the kids get hands-on learning. And I think, Mary, there are studies that show the hands-on learning is the learning that sticks, right?
Absolutely. In those schools that have some sort of personal finance requirement, the students are more likely to open up a checking account and a savings account and to continue savings in those accounts.
Yeah. Well, one of the things that sort of, I mean, it seems so basic about why this should be taught. I mean, it's one of these, it's not something that one day you learn, you know, that you have to deal with money and you forget about it, or savings or credit cards or interest rates. I mean, it's something that throughout life exists. And I noticed that there's still a relatively small number of schools. You say only 44, if this is a correct number, you can tell me. Only 44 of 584 schools surveyed report a standalone course in personal finance. Still pretty small. The work is yet to be done.
Well, you're right. We actually consider that number to be the good news.
The good news, because somebody's doing it, right?
Well, when we hired Penn State University's Research Center in 2007 to survey all of the schools in Pennsylvania, because as Mike pointed out, we have 500 school districts in the state that all determine their graduation requirements.
That's right.
So it was hard to get a handle on just what was happening in the state. And so we found in 2007 there were 20 high schools that had a graduation requirement.
And so how many do we have now?
In 2009, Penn State repeated the study, and we've doubled those numbers.
All right. All right, we're going to, all right, I had to talk over you, but they're in my ear. We're going to go to a break. We're going to continue this discussion following these words.
This broadcast of Pennsylvania Newsmakers is presented by Highmark Blue Shield, changing the way health plans work for business with a variety of plan options for employers and more choices for employees. Information is available at highmark.com. Have a greater hand in your company's health. And by the Pennsylvania Healthcare Association, the future of long-term care.
Hi, Mary. Look, before I rudely interrupted you, you were trying to say something about the curriculum in the schools, and I guess I have a question. You know, a lot of people, teachers, you know, I'm a professor. I don't feel comfortable doing this. Why not?
Well, for one thing, it's not something that they really get when they're in college learning how to be a teacher.
Yeah.
So what our office does is to provide in-service training and curriculum consultation. We even have a week-long Governor's Institute on financial education, where we invite up to 100 K through 12 teachers to learn how to either integrate personal finance concepts into their existing lessons or to create a standalone course.
Are you finding more interest in this in general? I mean, it's growing. I noticed we were sort of talking about the percentage, and you're happy about 10% now. I mean, are you incrementally growing?
There is growing interest in the school districts, but one of the bad pieces that we are finding is that there's still 15% of school districts that are doing absolutely nothing.
All right, now free stuff. Everybody likes free stuff.
The one thing that there is a lot of curricula available to teach financial education. Through our program, we work with the National Endowment for Financial Education, or NEFI. We can provide plenty of free stuff. You can also go to the Jumpstart website, www.jumpstart.org. They have a clearinghouse with
Even
lots
I
of
can
free
remember that,
stuff.
www.jumpstart.org. And you have a website,
Moneysbestfriend.com. And that
Money's Best, the S on that, moneysbestfriend.com. What's on that?
Well, that isn't just for schools. That's for all Pennsylvanians if they want to find out how to make smart money decisions or how to find a program near them.
All right. Does that mean people like me, I can get on this website and I'll even understand it?
Yeah, absolutely.
Oh,
Okay.
absolutely. And kids. Kids can get on there and play games and stuff.
There you go. All right. Well, we're out of time. As always, it's great having you here. Next year, we'll see if we've made any progress on this. All right. Thanks for watching this edition of Pennsylvania Newsmakers. And as always, you stay well. And you stay well.